Hello, in this video, let us look at another MBBS final paper question. Here you can see tricep brachii. They are asking for 5 marks about tricep brachii muscle. What are they asking about tricep brachii muscle? The origin, the insertion, nerve supply and actions of this muscle. So what will they ask about a muscle? About a muscle, they'll ask origin, insertion, action, nerve supply only. Okay. And they're asking for 5 marks. So let's dive into tricep brachii now. Where is tricep brachii? First of all, at the back. Okay. Pat yourself on the shoulder. Okay. Behind your humerus. That's your tricep. Okay. Are you feeling it? Yeah. Now here, this tricep muscle, two important bones you have to draw. So draw like this. I'm trying to draw a scapula and a humerus from back side. Okay, a very bad one there. So here you have a scapula and here you have a humerus, and you say that this is the right shoulder joint from back side. Okay, so posterior view of right shoulder joint, something like that you can say. Posterior view. Okay, like this you have to label this diagram, and now you bring in the muscle. So the muscle will have three heads, correct? So we need 3 heads for this muscle. So you have to draw a diagram, so it will give you a lot of clarity for you also. Then you can fill in the textual part later. Draw off the diagram, come back and fill in the textual part later. Okay. So now let us look at the origin. Now where are we here? Origin. So we have a long head, right? We can see a long head, then we can see a lateral head and a medial head. Okay. So a long head, a lateral head and a medial head. The long head comes from scapula, and the lateral and the medial heads come, where do they originate? Posterior of the humerus. Okay. Posterior surface of humerus, lateral and medial. Where do they originate? Posterior surface of humerus. Where does the long one originate? Scapula. Okay. This much if you know, more than enough. More details if you want. The long head originates from the infraglenoid tubercle of scapula. Some tubercle is there. Infra, obviously you can see at the bottom, infraglenoid tubercle of scapula. Done. Now what about the long and medial head? So there is a radial groove here. What groove is there here? Radial groove. Where is it? On the humerus. Now superior to that radial groove and inferior to that radial groove is where the 2 heads are originating, the other 2 heads. So the lateral head is originating superior to the radial groove, and the medial head is originating inferior to the radial groove, and both of these are posterior to the posterior surface of humerus. You got it now? Very good. So what and all did you get? Tricep brachii has 3 heads, so you got the 2 marks you have got now. Now let's go to the next part, insertion. Insertion is olecranon process of ulna. Okay, olecranon process of ulna. Where is ulna? Ulna, olecranon process of ulna. I'll have to zoom and check. Okay. And fascia of forearm. So it is not only just ulna, even fascia of some forearm. So just feel it. Okay, just tap your posterior surface of humerus and see where it is inserting. Oh yeah, I can feel it. It is inserting in the ulna only. Olecranon process only it is, I think. Yeah. Okay, and the fascia of forearm. Some forearm fascia also can you feel? Yay! Now you have learned the insertion also. Now let's go back here. So action, chief extensor of elbow. It has to extend your elbow. Who has to extend the elbow? Triceps. Okay, where is the tricep? Somewhere here. Right. So does it help you extend your elbow? Just check. Hold that muscle at the back of your humerus and check. I feel I can do it without that muscle. Okay. We are done with it. Extension of elbow joint. Very good. Then innervation is radial nerve. Obviously it has to be radial nerve or what? Which comes from C6, C7, C8. Everybody knows on earth. But do you want to know more about radial nerve? So see, this is the path of a radial nerve. At the back of the humerus only it's going. So obviously back of humerus, which muscle is there? Triceps brachii only. Okay. So this is the nerve innervation. Okay. Okay, so now you tell me again, let's revise. Describe the origin, insertion, nerve supply and actions of tricep brachii. Okay, so give an introduction. Tricep brachii is a muscle that has 3 heads, and you have the long head, lateral head and medial head. The long head is the longest, right, of the, yeah, it's the longest, and it arises from the infraglenoid tubercle of scapula. It is the longest of these 3 heads. Okay, then what else should you tell? So the lateral head arises from an oblique ridge on the upper part of the posterior surface of the humerus corresponding to the lateral lip of the radial groove or the spiral groove. So this thing is a it is the lateral lip of this groove. Okay. Then coming to medial head, let's go to medial head now. What does the textbook say? Medial head. Medial head arises from the large triangular area on the posterior surface of humerus below the radial groove, as well as the medial and lateral intermuscular septa. So between the muscle there is some septa. Between two muscles there is some septa, intermuscular septa. From the lateral intermuscular septa, lateral and medial intermuscular septa, also it arises. So the medial head arises from a large triangular area on the posterior surface of the humerus. Posterior surface of humerus we have learnt. This area is below the radial groove. That also we have understood. Okay. And it also arises from some intermuscular septa. Wow. It's a little complicated, guys. Wait. Breathe in. Breathe out. Okay, good. So now let us continue. We are looking at what? The textbook portion of this. Okay, so origin we are done. Now let's go to insertion. Now insertion, what does the textbook say? Textbook says that the long and the lateral heads converge. Yeah, so these heads, long and the lateral heads converge and fuse to form a superficial flattened tendon which covers the medial head and are inserted into the posterior part of the superior surface of the olecranon process. All I'm going to remember is the olecranon process. The medial head is inserted partially into the superficial tendon and partly into the olecranon. Again, olecranon is what we want to remember because giving way too much details, I feel. Okay. Although the medial head is separated from the capsule of the elbow joint by a small bursa, a few of its fibers are inserted into its part of the capsule. This prevents nipping of the capsule during extension of arm. These fibers are referred to as the articularis cubiti or as the subanconeus. Did you understand anything, people? I won't blame you if you didn't understand. Okay, so let's just move on and go to nerve supply. Nerve supply is a radial nerve. C7, C8 is what the textbook says, guys. C7, C8. Please go with that. We'll remove C6. C7, C8 is what you remember. Okay, and it will receive one special separate branch from the radial nerve. Okay, and where does this branch arise? In the axilla. In the axilla and in the radial groove. These branches arise and they give supply to the triceps brachii. Okay. Now, if you want one more mark extra, guys, then what you have to do, just out of 5 marks, they might give you 4 even after writing so much. 1 mark you give for clinical anatomy. Okay. So if radial nerve injury is there, then what happens is, if the radial nerve injury is in the arm, the tricep brachii is not affected. Why? Because it is getting nerves, branches from where? From axilla. Right, so if at arm level also, if the radial nerve is affected, triceps is not affected. Okay, not much, not complete paralysis, because it is having 2 branches where they said one is from radial groove side place and axilla place. Okay, I think this much is enough for this 5 marks. Okay, bye bye.